Okay, I'm going to have you follow along in your book. These are some of the medical conditions, medical emergencies that we need to be aware of. Peritonitis would be an overall. It means that the stomach, that abdominal contents, abdominal area is inflamed. That's all this means. It means that the lining that surrounds the abdominal cavity and the lining that lines over these organs, there's some irritation there, and it's causing a lot of intense pain. Peritonitis is a serious thing. It means that they have an acute abdomen and requires surgery. So this is a person that when you palpate them, the pain pretty much is everywhere. Their belly may become even rigid to the point where it's as firm as the wooden table. And at that point, maybe the pain is just so, the abdomen is so inflamed that maybe they don't even have that particular pain, but they would present more in shock. So inflammation of that abdominal lining as a result of one of these medical conditions as we list all the way down. Next medical condition is appendicitis. This was the outpouching, a finger-like protrusion. It's an appendage or such, as they say. It comes off of the right lower quadrant area, off of the small intestine and the large intestine, the ascending colon, where they sort of meet. It really has no major function. However, fecal material and products of digestion move towards this area, and it should be moved and cleaned out through this finger-like outpouching or appendage. It should then be cleaned out with peristaltic movement and then forced back up into the ascending colon. However, sometimes the material gets stuck in there and things get inflamed because it's just been sitting in there, and we have problems with it then starting to cause more than just inflammation, where it's going to start to wear away at the lining and then cause it to rupture. Now, usually appendicitis is a female, more like, and teens, early teens, mid-teens to early adulthood. It is the right lower quadrant, but it may start out initially around the periumbilical region as we go back to where our referred pain. As it starts to get worse and worse, and as it ruptures, then it's right in that right lower quadrant. It's called the McBurney's point. It's kind of in between where the pelvic crest is and the pubis symphysis. So it's right in between there in that right lower quadrant. And then you would palpate that, and it would be extremely painful. As it says, appendicitis, the itis means inflammation, and this could also cause inflammation systemically as the contents may be leaking out. Now remember, this is product of digestion, and then it's actually turned into what we would start to think about as fecal material. And so as this contents leaks out through this appendage, it then causes widespread inflammation and peritonitis. The person will also complain of pain when they lift up their right hip. They can't bring it up because it's causing the abdominal muscles to tense up, and it's causing to put pressure on the appendix. So if they bring their knee up to their chest, it's going to cause some pain. If they were to rotate their knee and thigh inwards and outwards, so towards midline and then laterally, it would cause more pain. These are our special tests that we call the as an obturator test. So this again is a medical emergency. It requires the patient to be seen at the emergency room and possibly having an operation surgery. Cholecystitis. Cholecystitis is the inflammation of your gallbladder. We saw the gallbladder lived somewhere underneath the liver. It then collected products from the liver, the creation of bile and bile salts, which are then emptied into the gallbladder, and during times of consumption and digestion, its contents would be emptied through the common bile duct and into the duodenum to aid with digestion. Sometimes this can get inflamed, and anywhere along that conduit and emptying tract, if it gets inflamed or develops stones in there, the person might complain of this type of right upper quadrant pain, and this upper quadrant pain can be referred to the right scapula or right shoulder. Usually this happens around when they're female 40s, pregnancy, fertile, and fat foods. So we try to ask these questions, and if they fit this characteristic patterning, then we might determined that it's a high probability of having cholecystitis because of all the risk factors. So fat, foods, female, fertile, and under 40. Gastrointestinal bleeds are usually called GI bleed. This can be upper and lower. Upper GI bleeds is somewhere in the stomach itself. Now, I know we usually call the stomach and we point to that whole abdomen. Well, we're going to remember that the stomach is the organ itself when we're talking about it. So sometimes in upper GI bleed, the acid contents wear away at the lining. And some people may even have what's called just below that, peptic ulcer disease, where these ulcerations or little cuts and abrasions are formed because there's just so much acid causing the erosion of the stomach lining. And so this may cause some irritation and bleeding as a result. Now, if they do have an upper GI bleed, they may complain of this peptic ulcer type pain, this indigestion, burning sensation, and then when they vomit, you will see more of a black hematemesis or bright red blood or some type of red blood that's coming back out. But more times it's digested because of the high acidic content. It turns the blood into a dark black coffee grounds like vomit. So we'd say like coffee ground emesis is what we look for. And blood in the GI tract or in the stomach is a GI irritant and causes people to really vomit up a lot. Now on the lower GI bleeds, we usually think that because it hasn't been digested in the stomach, the bleeding is not in the stomach, but more in the intestinal lining. So this lower GI bleed would cause the bleeding to be more red, and this would be coming out of the rectum, and we wouldn't see more of this upper GI symptoms such as the coffee ground emesis again. So upper GI bleed, we'd have that gnawing, burning abdominal pain. It may also have peptic ulcer disease, coffee ground emesis, and because the blood is being digested in the stomach, and then as it transits through the intestines, it comes out like a dark black tarry stool. It also has a very odorific smell to it. Lower GI bleed, again, there's no irritation to the stomach itself, but more to the intestinal lining. And in that case, this bleeding now is more of a red, and so it can be just a lot of bleeding through the rectum, or it could be streaked and heavily streaked around the stool. Keep in mind that we also have varicosities like a hemorrhoid that may leave bleeding on stool, so we'll have to discern, differentiate between those two. Gastroenteritis could be it basically means that this is inflammation of the stomach and the intestines, and usually a result of foodborne illness, or it could be something else that they take it in, and we've got now viral or bacteria in the GI tract causing them to have lots of vomiting, nausea, and diarrhea. And there are many causes. Now all we're worried about is that there's going to be a lot of water loss and not a lot of it being kept in or kept down. They may be able to drink it, but it seems to always be coming up. We went over a little bit of peptic ulcer disease. This is where the stomach lining is worn away because of a lot of acid. It is related to what's called H. pylori, which is a type of bacteria that got into the stomach and is causing the wearing away because of the overproduction of the acid. And somebody with peptic ulcer disease may also have that heartburn and may also taste the acid as they belch a little. And intestinal obstruction is usually a result of the contents of digestion as it moves from the stomach into the intestines. It can then either be obstructed in the small intestines or the large intestines. Because these are hollow organs, they can stretch, and so it's sometimes very difficult to discern like what type of pain is this, what's going on. So it's a lot of the history that you'll have to think about. This is going to stop the transit of the products of digestion through your intestinal tract, and so you may ask questions about their bowel movements A hernia is an outpouching through the muscular layer. This can be abdominal hernia or an inguinal hernia. It's basically the intestine that's laying over that particular area and then it pops through. We're only worried if it gets popped through and then it's trapped in there, or we would say is incarcerated, and when it's trapped it can be sort of choked off for blood supply. And you know that the intestines have blood supply through the mesenteric system. If it is choked out or incarcerated and the blood supply is shut off, it'll become ischemic and that bowel will die. Last one is the abdominal aortic aneurysm, and we've talked about this for the thoracic aortic aneurysm. This is where the pressure system from the left ventricle is extremely high, and people with uncontrolled hypertension or people with something like a connective tissue disease like Marfan syndrome, they may have more pressure in there and causes that blood vessel to be thinner, and it allows the blood pressure to cause a tearing away of that inner lining, the endothelium, and then into your tunics, separating them. And remember, as that pressure comes on, it continues to cut and cut and cut and wear away at those layers until it ruptures. So we want to make sure that we check the pulses in the extremities, the superior ones in the arms, and then the inferior ones in the legs, to make sure that those pressures are pulses are present and they feel the same, as well as blood pressures in both arms. Similar to the thoracic aneurysm, this pain is rip-roaring. It's intense and there's no position of comfort. It's ripping right straight to the back. Alright, as far as treatment goes, we need to do a good exam and get a good history. A lot of these require them to seek medical attention and perhaps even to have surgery for surgical repair. This is quite above our level of training, but we know that a lot of these would cause them to either become very septic, go into shock, and may even have reasons for significant blood loss. And so we want to treat for shock. We want to provide oxygen, and we want to probably keep them in a more of a supine position with their knees bent. Follow your local protocols.